The most important properties of a prosthetic from a patient's point of view are comfort. From a clinician's point of view, it's biomechanical performance. Traditionally, we'd use the materials that are available, which are rigid metals and ceramics. The drawbacks are that we have to understand that the mouth is an impact machine, and any impact machine needs a shock absorber, and these materials don't allow for shock absorption. I started using JUVORA about 18 months ago, a material that has 26 times more shock absorption than everything else that's currently available, because shock absorption is one of the things that a natural tooth possesses anyway. So it's not anything new, and something that has 26 times more shock absorption than most of the conventional materials available can't be a bad thing. Today, using JUVORA PEEK, I'm able to tune prosthetics for a patient to their very specific individual needs. Patients of mine who've had JUVORA PEEK instead of metal frameworks always report to me that their comfort levels are much better. The reason they can say that to me with confidence is usually because they've worn a metal-based prosthesis before, so they can tell the difference. And they all tell me the same thing: it's always more comfortable. I could have done with something else for the last 20 years of my career, and I'm very glad in the last 18 months I've been able to use PEEK. I use it clinically wherever there's a requirement for a patient to have comfort and shock absorption, which is in most of my cases now. In an average clinic, parafunction bruxism, in my opinion, would probably affect between 60 and 70% of their adult patients. That is a very, very big problem. Now, we've not been able to address parafunction with conventional materials because they're either very hard or very brittle. JUVORA PEEK gives us a new option because it gives us something that has bounce, for want of a better word, and that makes all the difference. The importance of reducing implant restoration damage is paramount because you aim to want to do something once. So if you can use highly engineered materials which can give you much greater long-term predictability than convention, then it's everything. It's very important. JUVORA is a great solution because they've got a tried and tested history in the medical implant field from their experience in spinal cage surgery, and it was just logical that it would apply very well in the dental field because we have a lot of similarities.